This was a safety trial, so a phase 2 dose escalation safety study of using tenecteplase, so TNK, in minor stroke patients who have an intracranial occlusion. So these are the very mild stroke patients with a blocked blood vessel in the brain. And so this was a safety study and a proof of principle that despite having minor symptoms, we could find these patients and treat them safely. We found that it was safe. There was one intracranial hemorrhage out of 50 patients, so a low intracranial hemorrhage rate. We also found that, as previously we've identified, that minor stroke is not always benign. So, a significant proportion of patients, so around 40%, ended up with some sort of disability. Not major disability, but chronic minor disability that means there's something they can't do. We also found that we had a beautiful relationship between opening up blood vessels and outcomes. So in patients who we did open up blood vessels with tenecteplase, they did very well. And so there's a very clear correlation with the pipe is blocked, open it up, and patients do well, even in a minor stroke population. The same idea as the major trial showed yesterday, that opening up blood vessels is what counts in stroke. We expect that there is a level of intracranial hemorrhage with any clot-busting drug. We know that from myocardial infarction. So we expected one at least. We were hoping it would just be one, and that's what we found. And that's one of the reasons that the main trial needs to be done, is that we're not, the confidence intervals in a 50-patient study are obviously wide in terms of the amount of hemorrhage. And so the study needs to be done to know what the sweet spot is. None of these patients were very disabled, or few of them were very disabled. Most were minorly disabled. And the question is, where is this sweet spot between taking a little bit of risk for benefit? And that's what we need to find out. So the NIH Stroke Skills Score is one way of doing it. Essentially is rather than somebody being hemiplegic or unable to speak, they have some minor amounts of disability. So that might be a little bit of a facial droop, a little bit of dysarthria, a little bit of a drift of the arm. And so in terms of the numbers, we included patients up to a 5 on the NIH Stroke Skills Score. The NIH Stroke Skills Score is a good scale and overall works well. There's obviously little bits of nuances because not all 5s are created equal, and 5 being all involved with speech versus a little bit of something and a little bit of something else is a different thing. And so the easiest way to do it is to use numbers, but somebody can have a 1 and that wouldn't be considered minor for them, or somebody can have a 5 and it's still not it is minor. So it's complicated is the answer, but the way we did it was we simply used the NIH Stroke Skills Score. If you completely recanalized, which we found a high proportion did, so in our higher dose tier, 60% of patients recanalized completely. And so that was a very high recanalization rate. And often in front of your eyes, these patients would completely go back to normal. So their speech deficits would just resolve. So it's pretty cool. And the nice thing about tenecteplase is it's a bolus. And so the drug is given immediately over a minute in the emergency department and is in the system immediately, and lasts for longer in the system as well. And so certainly improvements we saw were in front of our eyes. Yeah. I mean, it's pretty amazing. And it's obviously why we do what we do. And the patients love it, obviously, and particularly in this population, because for the most part, they're aware of what's going on, unlike people who often have these major strokes who are not, they're really not quite clear what's happening. So the minor stroke patients are incredibly grateful because they see this medicine and they see their body getting better in front of them. And so they're actually way easier to get to come back to talk to reporters because, they understand what happened. Yeah.